the risk in life, but we do what we can to minimize those risks. That is what masks do. Another speaker claimed that they could not find a single study that showed the efficacy of masks. My wife worked as a nurse in the operating room. Everyone in that room wore a mask the entire time. No one complained about it, and none of the surgeons suffered from carbon dioxide poisoning. And it wasn't because they were afraid of catching bone cancer from a patient. It was to protect the patient. I wonder how the person who made this comment would feel if their surgeon refused to wear a mask the next time they have surgery. It is the doctors' and nurses' personal freedom, and this is America after all. By the way, the person who made this ridiculous claim is running for the board. The people who oppose masking have cited the number of signatures they collected in past meetings, somewhere around 750. With over 32,000 people residing in Bethel Park, this represents less than 2.5% of the population. You are passionate, you are vocal, and you deserve to have your concerns and opinions heard, but you represent a small minority of voters. I don't live in constant fear of the virus. What I'm afraid of is living in a society where we are unwilling to endure even the smallest inconvenience to keep others safe. I also feel living in a society that is not scientifically literate enough to evaluate whether something that drops into their Facebook feed is solid, peer-reviewed science or a baseless conspiracy theory. We should be using this time to discuss curriculum and actual education issues, the things that will actually help our kids succeed in an increasingly competitive global economy. But instead, we have spent hours debating whether or not we should wear masks. And although I hope that I'm proven wrong, when the school year devolves into a hot mess of rolling closures and 14-day quarantines, the very group of people who have refused to act like adults—
Please finish up.
Last sentence. The very same group of people who have refused to act like adults and make small sacrifices to slow the spread of the virus will be the same group of people lined up at the next board meeting with their pitchforks whining about it.
Thank you.
David Burke, 5868 Lorraine Drive. Good evening. We definitely need some unity, and mask mandates do nothing but divide. I mean, it's pretty obvious. And I'm disappointed that we're here again talking about this, but parental choice is the only solution. I have 3 kids in 2 different schools. We were all on board last year, wore the masks every day, played along with the mandates and the closings, and we're not doing it again this year. Each of my kids had their worst reporting year ever. The stress and sleepless nights it caused were far too many. Enough is enough. If you want to mask up, it's your right. It's my right too to not mask up, and also for my children to not mask up if I see that's fit for them. Children aren't dropping dead all around us from this virus. It's ridiculous. They're more likely to get killed in a car accident. You know the most dangerous thing we do with our kids every day is put them in the car? Way more likely, 1 in 17,000 chance of dying in a car accident versus 1 in 180,000 dying from COVID. This is kids. Most COVID deaths have been over 65 years of age, obese with at least 4 comorbidities. This is not in the children. Free the masks. Enough is enough. We're told to believe the science, yet the head doctor of the CDC has the audacity to say that men can have babies. Pregnant people, she referred to them as. That's a disgrace to moms everywhere. I'm not taking advice from somebody like that. I'm sorry. Science is science. The only solutions that are being shoved down our throats are to mask up and to get vaccinated. And highly qualified physicians are being censored if they suggest a preventative approach to fighting viruses. It's ridiculous. We are allowing politics to ruin our children's access to quality public education. And it is time we the people be united and stand up against this tyranny. Kids need to be kids. Do not teach them to live in fear. As parents, we need to encourage our children to live in love and strength.
Please finish up.
The path we choose now is critical. Thank you.
Kathleen, are you there? Please state your name, address, and you have 2 minutes.
Kathleen Cole, 2211. About suicide. I've read over the past 17 months in multiple local groups the hypothesis that suicide completely declines in isolation.
Tell her to do something.
We're having a little trouble understanding you.
Hello? Is this better? Sorry.
Yes, much better.
Okay.
Go ahead.
Problem is,
Tell her to call back.
Yeah, if you could call back in, you're dropping in and out. Sorry.
Hi, my name's Karen Hoskinson. I live on Madison Avenue. I just wanted to let the, people who don't work in healthcare and hospitals know that if I go into a room with someone with a compromised immune system, I have to wear a mask to protect them from me. They don't have to wear a mask, but I do because, they're vulnerable.
Please,
Okay.
please.
Thank you. For all you healthcare professionals out there. The consensus of public health officials, epidemiologists, pediatric infectious disease doctors is that the safest way to get kids back to school, which they so desperately need, which we all agree, is to mask, distance, increase ventilation in the schools, and to incorporate good respiratory and hand hygiene. That's how we do this safely, and that's what the consensus is. Wearing a mask is the absolute minimum thing that we could do. It's the bottom of the barrel, least amount of work that we can do to protect others in our society and ourselves. It seems that children don't get sick as much as adults do, but where do you draw the line? How do you know that your kid, if they get COVID, isn't going to be the one in the ICU? You don't. We don't. As parents, we don't know that. So we should be doing every single thing that we can do to mitigate the risk to our kids who need to go to school. Also, our kids can be asymptomatic carriers. They could be completely healthy. But we have family members at home that might not be so. So how are we going to, excuse me, how are we going to mitigate that? Don't you want to protect everybody?
Thank you.
Thanks for being.
I would ask you once again to not shout out while someone else is speaking. Thank you.
My name is Lynn Ruffing, and I live at 5673 Valley View Drive. And I'm going to make this short and to the point. You do not have the authority to dictate what is in my child's best interest health-wise. You do not have the authority to override my God-given right as a parent to decide what is best for my child's health. I am the mother, and I will be the one to decide what is best for my child, and masking him is not in his best interest. Do not overstep your authority. Vote to make masks optional. Otherwise, you will be seeking to strip me of my parental and civil rights, and I will not let you do that. My child, my decision.
Jesse, are you there?
yes, I'm here.
Okay. Can you state your name, address, and you have 2 minutes.
Cassie Grisbeck, Milford Drive. I am a senior professional staff nurse in the medical ICU at UPMC Presbyterian.
Can you please state your name and
For the
address?
past year and a half, I did. Cassie Grisbeck, 2763 Milford. For the past year and a half, I have been taking care of some of the most critically ill COVID patients. At this point, my coworkers and I have lost track of how many people's hands we've had to hold as they took their last breath. It is true that children generally have not had as severe outcomes as adults. However, with the emergence of the Delta variant, we can see that outcomes for children are no longer mild, with hospitals in the South running out of medications, beds, and oxygen. In Pittsburgh, adults have the privilege of choosing between several large medical centers, which has largely prevented us from becoming overwhelmed with COVID patients. However, kids in Western PA only have access to Children's Hospital. Children's Pediatric ICU has been frequently full over the course of the past month. An increase in critical COVID cases not only risks the lives of children with COVID, but also the lives of kids needing ICU care for any other reason. Therefore, it's no surprise that the consensus of pediatricians, including the chief of pediatric infectious disease at Children's, support universal masking in schools. Masks have been consistently proven to decrease the community spread of COVID. It is for this reason that every major medical center in the United States requires universal masking for all providers, patients, and visitors, regardless of vaccination status. Additionally, there's not a shred of evidence that masks cause appreciable harm to the wearer. This is displayed anecdotally by myself and my colleagues having zero negative side effects from wearing N95 for 12 hours a day for the past year and a half, as well as a litany of studies that I know have already been shared with you. The inability of some of you to understand this research does not reduce its validity. I completely understand why this is such a difficult decision for some of you to make. On one hand, you have people telling you that you're committing child abuse, violating the Nuremberg Code, and letting socialism into the United States. On the other hand, you have people citing the American Academy of Pediatrics, the CDC, leading virologists and epidemiologists.
You're at 2 minutes if you can finish up.
I don't know how you could possibly decide. Thank you.
Okay, my name is Christina. I live at 5680 Valley View Drive. And let me remind you, at the beginning of the pandemic, the head of the NIH, Dr. Fauci, said there is no reason to be walking around with a mask. Respectfully speaking, can you explain why there would be a mask mandate for our kids when CDC and NIH findings have shown that that children do not spread the virus effectively and are not harmed by it unless they have an underlying condition? As I understand, Governor Wolf has lost his pandemic powers and can only make recommendations, not mandates. For example, I recommend you, who enforce the mandate, look for a new position because the voters will speak at the next school board election if that is the case. I don't want to see smiling eyes tomorrow on the first day of school and this school year, but smiling faces. Thank you.
Sir?
My name is Chris Kellner. I live at 3202 Eastview Road. I'm here tonight because I made a mistake I imagine a lot of parents made. I believe that this board would make a rational decision based on reason and evidence to mandate masks for this school year. That belief was a mistake. Some of you on the board seem to believe that you represent the parents of this district. You do not. You represent the best interest of the children of this district. And the best interest of the children of this district is unequivocally, undeniably, and indisputably mandating masks until such a time as vaccines are available for all school age groups. Should this board fail again, then you will deserve all of the legal, moral, and ethical ramifications that come with that failure. Mandate the masks.
The system did not pick up your name. Can you please state your name, address?
Yes, Dan Grisbeck, 2763 Milford Drive.
Okay, you got 2 minutes. Thank you.
Good evening. I'm commenting today requesting that the board add universal masking to the health and safety plan. I'd like to start off by addressing a few inaccurate statements from Mr. Spacuzza at the last meeting. He mentioned the 5% positivity rate in Allegheny County as the reason we're in the substantial range. We are, and still are, in the high range, above substantial, and it's due to our case count of 132 cases per 100,000 people, not our positivity rate. If you remember, incidence rate was also a parameter for determining risk level last year. Additionally, the positivity rate in Bethel Park is far greater than Allegheny County as a whole. We were at 10.68%, while the county is only at 4.86%. Mr. Spacuzza also cited the size of the virus as the reason that masks do not work. As anyone with a basic understanding of respiratory viruses knows, the viral particles do not travel by themselves. They are entrained in respiratory droplets and aerosols, ranging in size from roughly 0.3 to 20 micrometers, as shown in Morawska 2009. Lindsley 2020 analyzed...
Can you slow down just a little bit? We're having trouble understanding you.
Sure. Lindsley 2020 analyzed the effectiveness of masks at capturing these different size particles and found that cloth and procedure masks capture 30 and 40% of the smallest respiratory particles exhaled respectively, while capturing over 80% of the larger droplet particles. The study Mr. Spicuzza cited that concluded face masks are ineffective to stop viral particles has been retracted due to misquoting of several source studies, omission of information, lack of verified data, and incomplete peer review. He also cited the DAM mask study, which does not analyze the efficacy of masks as source control and is therefore inappropriate in the analysis of whether or not to incorporate a mask mandate. Having an appointed public official spewing misinformation is extremely irresponsible and only serves to exacerbate the harms of this pandemic. In order to assure that this does not happen again, I sent you all 10 studies on Thursday, including summaries, that clearly show masks are effective at reducing the spread of COVID. Considering none of you responded, I can only hope you took the time to read the email to ensure that you are actually making decisions based on the most up-to-date, accurate information.
You're at 2 minutes. If you can finish up.
I'm done. Thank you.
My name is Brendan McCarthy. I live on Jordan Street. Nurses, teachers, bus drivers, bankers, stay-at-home parents, people of all other walks of life came before you last Tuesday and today to argue both sides of a scientific argument. The problem here is obvious. None of these people, including myself, are scientists. Fortunately, the scientists have already had their debates. They had them at the CDC, they had them at the NIH, they had them at the WHO. They've had them at hospitals across the country. They've had them in pediatric groups like the American Academy of Pediatrics. The scientists have made public the results of this debate, and the scientists have decided that masks work at preventing the spread of COVID. Now, you can agree or disagree with the scientists all you want. But the fact remains that the quarantine procedures created by the county are built off of the results of this debate. Because of that, I fail to see how this school board thinks that mask optional is even a legitimate option. With the quarantine procedures being what they are, masks optional means we will be forced to quarantine more healthy kids when the goal should be as few as possible. We will be quarantining more than Baldwin, Keystone Oaks, Mount Lebanon, Upper St. Clair, and Peters Township. And with the asynchronous backup model, we will have a lot more kids learning from packets instead of from their teachers. This, in turn, means that our kids will be falling behind the kids from the neighboring districts I just mentioned. I think everyone here can agree we need to be doing everything we can to keep healthy kids in class. The problem is, there isn't an objective person in this room that can look at the mask optional...
Sir, will you finish up, please?
One more sentence. That can look at the mask optional plan and claim that it achieves that. Maybe today, you can try and show that you care about the quality of their education.
Thank you.
Hello, my name is Candace Bush. I live at 898 Clifton Road. It is vital that students who have to quarantine can continue their education remotely. My family does not go on vacation during the school year because I know how important it is for them to be in the classroom and how hard it is to catch up because I am a teacher. If students are told to quarantine, they will be missing 2 weeks of education. How are you going to accommodate students with IEPs? With the CDC guidelines constantly changing, as I said, I'm a teacher, I saw it constantly changing last year. How are you going to know at one point they're going to say, it doesn't matter if you're wearing a mask, that if you're in so much distance around each other, you have to quarantine. It can change. It changed multiple times last year. As a parent and teacher, I would continue to ask for masks to be optional. When reading the packaging on a mask, I wonder how effective they could be when it states not for medical use. These are cloth masks. They were made only because of this pandemic, because we needed masks to wear. They are not made for medical use. If a school wants masks to be worn for true protection, then N95 should be provided for all staff and all students at all times. And what are you going to do during lunchtime when students are taking off their masks to eat? Are you going to have to quarantine students who are eating, who have their masks down? You really have to think about this.
John, are you there?
My name's Dawn.
John, I'm sorry, it came up, John. Can you name your address, and you have 2 minutes.
Hi, my name is Dawn Sistro, 2518 Oldfield Avenue. I keep hearing everyone talking about our kids who are not eligible for the vaccine, but no one has even mentioned our kids 12 and over who are fully vaccinated. According to the CDC, these quarantine rules you mentioned do not apply to fully vaccinated kids. So why are there not separate rules in place for IMS in the high school, for the kids who actually are eligible for the vaccine and who have made the decision to get it? I don't think this should be an all or nothing mask or don't mask situation. I think there are many different variables here and many proposals that could be made. So I ask the board members to consider all of the variables and come up with a new proposal that considers the vaccinated kids, considers the specific instances that our unvaccinated are in, such as out on the playground or in the classroom. They could take them off and only wear them in the hallways where there are congested areas. I don't think we have done our best for our kids with the proposal you have before you today. I think we can do better. Thank you.
Hi, good evening. My name is Christina Headley, 5881 Irishtown Road. I would just like to ask, I know that you had stated that there were 82 staff members and 185 students, so that's 267 total for our district that tested positive, and 1,400 had to quarantine. Do we know how many out of that quarantine as close contacts tested positive? Is there a number that was given? Did I miss that? Oh, so, okay, all right. I just thought that would be a good statistic to know. Also, for close contact tracing, we're talking about the masks, and yes, the masks are a part of it, but so is physical distancing. So are our students' desks 3 to 6 feet apart? What about when they eat lunch? They take off their masks to eat lunch. What about whenever they have mask breaks? If it would be to mandate the masks, if the policy would be changed, what about when the kids go outside and play? They're outside, so would they be able to take off their mask? How about for phys ed? Because I know for my daughter played soccer. In the fall, she didn't have to wear the mask. In spring, she did. In one practice, she went through 8 masks. They were dripping wet with sweat. So during physical activity, it's just not healthy. I appreciate your time, and I hope you continue to keep them optional.
Eric, are you there?
Yep, I'm here.
If you can state your name, address,
Let me meet the email.
in 2 minutes.
Derek Kierstein, 5953 King School Road. Can you hear me?
Yes, we can.
Okay. I support parental choice for all health matters. A quick recap of the last 2 months of this district. An email was sent on July 9th stating that masks were required when in district facilities. I'm given information that this email was sent in error. There was, quote, a miscommunication in the central office. 2 days later, another email was sent. This email states a clarification in the previous email that the guidance that was received was a recommendation and not a requirement. While it may seem that the voices in the petition of those that supported parental choice triggered this, quote, clarifying email, that was simply not the case. This erroneous communication was the result of poor management. A July 12th school board meeting was held where approximately 60-plus citizens attended, and the board supported parental choice overwhelmingly. Quote, you have no masters up here, quote. They are optional. It's up to parents to decide unless governing authority tells us they're mandated. Quote, it's your choice. Another board meeting is held August 2nd where a medical professional is in attendance, sharing less than alarming statistical evidence, and some citizens attended to support a mask mandate in our schools. No federal mandate is in place,
But rumors start to fly about union pressure on school board members. These rumors are repeatedly shut down by any and all emails to the school board. Still, no federal mandate is in place. On August 17th, our community witnessed one of the most toxic and divisive meetings to date. Threats were made on social media, and jobs of school bus drivers were threatened. The board kept the plan as is. Still, no federal mandate is in place, but the trust in our elected officials is starting to dwindle because not all members were present at this meeting, and the meeting felt like theater. Less than 24 hours after the conclusion of this toxic meeting, it is announced that another meeting will be held the night before the first day of school. Trust in our elected officials is really taking a dive. Politics are at an all-time high, and pressure from the union is mounting. Still, no federal mandate is in place. This process has been humiliating for our district, divisive for our community.
You're at 2
It's not
minutes if
about
you can
public
finish.
health. The school board has made this political. Our community does not trust the board. Prove me wrong, respect the difference of opinion, and keep the health and safety plan as it stands for our children's education. Thank you, and God bless.
Matthew Urian, 5520 King School Road. I don't normally like to do this, but I'm just going to share my credentials a little bit. So I have a degree in horticultural science, but with a degree in biology with it. I studied microbiology. I took a 400 level and aced it, biostatistics class that would make most people's heads spin. My sister holds a master's in nursing. My wife holds a master's in nursing. I've spoken directly with doctors, and I don't share this to make it sound like what I say is going to be right. I share this because I feel like though we may be a little rowdy over here sometimes, we're treated like we're stupid. We're treated like we can't know what we're talking about. Just the yep over there kind of confirms that. And I hope you can see how divisive everything has been. We're teaching our children to look at other children as if they're disease vectors, as if they're nothing more than a bag of flesh walking around just waiting to pounce on them with the disease. And what future does this bring for us? What future does this bring for us as a community, as a country? There is no consensus on the mask. I've read the studies too. We have a lot of poor studies out there. We have some good studies out there. I'm a little disconcerted that we don't have too many controlled studies where we're controlling for the variables. Most of it's observational data. And I just want to say that in the vacuum that is a lack of understanding, and a vacuum that's in a lack of clarity, I think defaulting towards our roots of individual freedom and parental choice and loving one another, even if we choose differently, whether to mask or unmask, I think those are the important things this country is built upon, and I think those are the things we should default to in a time of uncertainty. Thank you.
Matt Heineman, 1115 Sarah Street. I completely agree. We should do everything we can for our neighbors, show we love one another. Personal choice is great, but you're making your choice for your child, which then dictates another child or multiple children have to go home. That's not personal choice, and that's not loving one another. I heard a lot about Fauci's comment. Funny thing about science is we don't always get it right, but we fix it. We learn. We change our mind. That's the one thing the other side of this auditorium doesn't seem to do. Fauci later stated he was concerned about the availability of PPE for healthcare workers at the time. He also noted that when he said that, it was early in the pandemic before health experts fully understood how contagious the disease was and how it spread. But he changed his mind because he learned. We can't just take a static soundbite and say, hey, that fits what I want. That's it. No more learning. This is a public school. I heard a lot of religious comments. That's fine. That's fine for you as your personal choice. But that doesn't dictate for the community. And by the way, the religious schools have mask mandates. They do.
Please.
And Although you were made in God's image, don't want to cover up.
Hold on a second.
I noticed you showed up in clothes today. Thanks.
Madam President, if speakers are interrupted in the future, could we please have them removed? We need to maintain decorum and respect everybody's point of view.
Thank you.
Okay, that's enough. That's enough. That's enough. We're trying to be calm, kind, respectful of one another, please.
Amanda, are you there?
Hello?
Amanda?
Yes, I'm sorry.
Okay, could you state your name, address, and you have 2 minutes.
It's Amanda Vignoli, 643 Galway Drive. Thank you, school board, for taking the time to listen to my statement tonight. No matter the decision, there will be an upset group of people. Our primary responsibility, though, as parents and board members, is to ensure that not just my child or your child is safe, but that all students are kept as safe as possible and get a quality education. We need to be doing everything that we can to protect our kids, and for that reason alone, I ask you to mandate masks in our school. This is not about community politics. It's not about making employees happy, nor is it about choosing sides in a popularity contest that has no real winner. We should not be putting this decision ultimately in the hands of adolescents. They're kids. And to ask a child to ultimately make a game time decision about their own health, as well as everyone else they come in contact with, is ridiculous. Ask yourself, how many children will be getting sick before we have more disruptions in schooling? How many children will be bullied for making this decision to mask, or for that matter, not to mask? For those of you who are, there are alternatives for parents to meet halfway if traditional masks are not optimal for their child. Face shields, masks with clear windows, it addresses the lack of communication or social interaction. We're seeing the effects of not mandating masks around this country, and I want this pandemic to be a memory. We all want our children to be protected and educated. And for nearly half of our student population, including 2 of my children, this is the only line of protection. The goal here is safety and education for all, and the only way to achieve that is with masks. Please vote for masks. Mandate it. Thank you.
I would like to remind everybody, please, these comments are to be directed to us.
Hi, my name is Jewel Corbel. I'm on Boxer Drive in Bethel Park. I don't generally speak, but I would like to speak today and keep this very simple. This is still a virus. This virus did become very political. I have you who's sitting here with your mask under your nose. The mandate would be that the children would need to wear a mask properly, which states it needs to cover your nose, cover your chin, be against your face. The true mask to protect you from this virus is an N95, not our cloth masks, not our disposable medical masks. There's no true protection to the children there. Our children are out today. They do play. The bullying, I believe, will come more from parents than the children, as I watch many groups of children who choose. There's half of a group that won't have a mask on. There's children in that group who are wearing a mask because that's their choice. They're not being bullied. They're still going out with their friends, and they're coming together, masked or unmasked, how they feel safe. Education is number one for our children, but it needs to be a parent's choice at the end of the day. We keep talking about vaccination. There is no government mandate for a mask. And the recommendation is stating that whether you have been vaccinated or you're unvaccinated, it is recommended to be masked today. The variants change. It's a virus. The flu virus still kills just as many people. The people dying are having underlying conditions, as a virus isn't treated. If you take your child to the pediatrician with a virus, they tell you to go home, push fluids, and rest. Let the virus run its course. This is the same thing. Children who are being treated, adults who are being treated, it's the underlying conditions that are being treated. that are being pushed over the edge by the virus because their immunity is lower and that the virus is then exuberating the other issues that have been with the patient. That's all. I hope you keep the mask optional and respect the parents' choice for the classroom this year. Thank you.
Rebecca, are you there?
Yes, I am.
Okay. State your name, address, and you have 2 minutes.
Sure. My name's Rebecca Kellner, 3202 Eastview Road, and you are going to hear my children in the background because I am trying to give them an excited bedtime before school. I have very little to say, but do want to point out the inaccuracy that the majority of schools in Allegheny County are optional masking, when in fact the majority are mandating masks. This is the reason I have asked the news stations to be here tonight. If the school is going to make this a hard decision, you are going to do it in front of everyone. You are going to tell everyone that Bethel Park is not going to protect their children. If you won't listen to the resounding opinion of the experts, you're surely not going to listen to us. But I want to say I am personally extremely proud of the unity you are demonstrating tonight. All but one of you are sitting up there with a mask on. You are demonstrating the education you are providing our children, and that is one of science. Thank you for finally stepping up and showing some unity in the safety of our children, who, as we have said, are watching. I implore you to please mandate masks, protect our children, and for goodness sakes, do everything you can to keep them in the classroom. Thank you.
Diana Manzini, 3286 Thornwood. You know, united we stand, divided we fall. There's a lot of tension, and our kids can't take that anymore. It's obvious that 2/3 of the parents want optional. They're taxpayers, they're the parents of the kids. They know what's best for their kids. We've seen different news. You've seen something that I haven't seen. I've read up on studies from some scientists and medical on my side as well, or our side. But when you have 2/3 of the parents asking you for the optional, I hope that you understand that that's important, because what will happen is you'll have this whole thing is a new type of segregation when you say mask. You're going to have 2/3 of the kids coming to the school, maybe not coming to the school anymore. What does that do to them? When you say it's going to be mask mandate, what does that do to the rights of the rest of the kids? 2/3 of the population of the school. What are you telling those kids? You know, the kids who, look, if their parents want to wear masks, they can wear masks. Respect that. Respect both sides of this. But when you've got 2/3 of a school saying, we want the option, they're looking into something you haven't seen yet. You need to open tomorrow with an option of mask. And that's all that I wanted to say. It makes no sense that you would turn your back on 2/3 of a school by mask mandate as opposed to option. Option makes everyone happy. That's it. It's common sense.
Isaac, are you there?
Yeah, I'm here.
Please state your name, address. You have 2 minutes.
Isaac Dawson, Florida Ave. This has been interesting. I've never done one of these before. It's pretty silly to watch. I don't know how this is even a debate at all. I don't know why parents think they have a choice, because you never did. Your kid has to go to school. They have to have medical checkups. They have to have dental checkups. You have to have a vaccine card. Like, you've never had a choice. Why do you think you get one now? It's pretty ridiculous. It does, there's no, just because you're a parent doesn't mean you know what's good for your child. Like, legitimately, how many things have warning labels on them? Not for the kid, for the parent. So you know your kids won't die doing something. It's inconceivable to me that this is even a debate when everything says it's a mandate because optional doesn't do anything. If it did something, that'd be a different story. It doesn't work that way. And the difference between last week and this week is that the county went from substantial to high. So, you know, good work, guys. That's it for me.
Hi there, I am Sarah Booten. I live on 2636 Milford, and I had to bring her because my hands are a little bit full, so thanks for making the time to hear me out. Folks, I called you from my vacation last week with my family because I thought this was such an important issue. Wasn't expecting to do this, but here we are. I thought I was gonna be getting my kids into bed, getting them ready for the first day of school tomorrow when my husband said that he's watching a live stream because apparently the masks are back up for a vote. I thought this was already settled. I thought it was already voted on. So I'm not sure how at the 11th hour, just because maybe somebody doesn't like the result of the election, that we have yet another election I just didn't think that was how that worked. Life is full of risk. I mean, we can't say we're gonna ban cars because there's a chance that we might get into a car accident. Kids eat food, they could choke on food. Do we need to make sure that they're just drinking Soylent Green from now on because they could choke? Folks, COVID's not going anywhere. It's here to stay. I realize that I think a lot of people think that the vaccines are gonna help. Maybe they are helping, but the cases still continue to climb even though we have a lot of people vaccinated. And we have to make a decision. Is this the way we're gonna live the rest of our lives? Are we gonna be afraid of everything? I can't continue to let my kids be masked. I didn't keep them in school last year because I thought that it was far more detrimental for them to be wearing a mask that they're breathing into all day. I was on a flight, people, while they were masked, are touching things all over the plane. The insides of planes are filthy, and then they're fidgeting with their masks. You know, if you're really worried about spread, maybe worry a little bit more about cleaning things and telling kids to wash their hands. The masks, I think, are a safety net that make people feel better, but I don't see how it's going to stop the transmission of COVID. It's here to stay. We've got to move on, and we need to have masks optional for our kids.
Christy, are you there?
Yes.
State your name, address. You have 2 minutes.
My name is Christy Griefke. I'm at California Avenue. There are many terrible stories of COVID-19 cases in schools around the country. From hundreds of students in quarantine to the deaths of students and teachers. Why even take the chance when mask mandates are an easy option to help mitigate those same things from happening here? Are we really able to say we're providing the best education possible if we're willing to put our students, teachers, and staff at risk just so some people aren't inconvenienced by wearing masks? There's an expectation that the district will do what it can to help protect vulnerable children, and that is not unreasonable. My soon-to-be fourth grader is very social and needs contact with his friends, peers, and teachers to be happy and get the most out of his education. Anyone who knows him knows that he will absolutely be the first to tell anyone if something is unacceptable, and yet he has no problem wearing a mask at school. He understands that he wears a mask to keep others and himself safer. I'm also concerned about my older son who will be attending IMS, but he is vaccinated and will also wear a mask to help lower the risk of getting COVID and passing it on to his younger brother. It is unacceptable that masks are not currently being mandated in our district. Non-vaccinated students are at especially high risk if there was to be a Delta variant surge here, and masks would help protect them. I do not want any students to be needlessly vulnerable, and I ask the district to promote this by taking common sense precautions, such as mandating masks. Bethel Park is a great community, and it would send a wonderful message to other places that our residents care enough about their students, teachers, and staff to require masks to help keep all of them safe. Thank you.
Amanda Wotan, Brookside Boulevard. I think what everyone misses is it doesn't matter if you wear a mask or you don't wear a mask, you will shut this school down for cases. It's gonna happen. You did it to us last year, just like you're doing to us this year. Last minute, 9th hour, no warning. Where was this meeting even published that it was supposed to happen? Aren't you supposed to do that? Publish meetings? If your vote couldn't stand on a 4-4, then you shouldn't have held the meeting. It shouldn't have taken place last week. These people shouldn't have to go through this over and over and over. Last year we mask mandated. We still got the 9 o'clock phone call. We still got the, you're not going to school for a week. Oh, honey, you were supposed to have pictures tomorrow? Sorry, your school shut down for who knows. Don't tell me that if I mask, they don't mask, she masks, he masks, we're gonna stay in school because we're not. Your union's gonna somehow come in and say, we can't do this. Your teachers gotta do this, the kids gotta do that. We're gonna be jumping through hoops all over again for nothing. Don't put your faith in a mask. Don't put your faith in a no mask. We're not going to be in school.
Do you have something else?
Go ahead.
Yeah, you're good. Sherry Wetzel, 375 Dale Road. I am once again asking the board to keep the mask optional. Our kids were masked from January to June, and the numbers continued to go up. What happens when these kids sneeze or cough? They will either pull the mask down and out goes their droplets, or they will sneeze or cough into their mask, move it around, touch on their face, touch on the lunch tables and desk, and the virus will spread. The thought that a piece of cloth or paper will stop, that is silly. The older kids, high school age, wear these masks as a decorative chin strap. I've seen it with a ton of them. Having a son that participates in soccer, football, and wrestling at the high school. Logic has went out the window, especially when it comes to high school age students. I'm asking the board to use logic and keep masks optional. Thank you.
Julian, are you there?
Yes.
State your name, address. You have 2 minutes.
Hi, this is Julianne Bowles at 3237 Coastgate Drive. You've heard from all of us for hours, and I think that most of you already know that masks are our best bet at keeping our kids in school this year, just like Upper St. Clair, South Fayette, Peters. So I actually just want to point out that this is super temporary. Pfizer authorized the vaccines, full authorization, yesterday? Vaccines are going to be here really, really soon for all of the ages of the students in our schools, and that's when parents really will have a choice. But for now, I support universal masking. I also just want to say that I hope in general we're keeping the precautions from last year, particularly in the lunchrooms. Just seems like that may be one of the riskier environments this year. And finally, just a little concerned about what students are going to do on days when they are sick or if they get quarantined. I just want to make sure we have a really robust learning option for anyone who needs to stay home for any reason, especially our kids who are just learning to read. So thank you all for your service. Thank you very much.
Sean Tomaszewski, 2035 Millennium Court. I was trying to figure out a perspective to share with the board this evening. I have degrees in microbiology and neuroscience from the University of Pittsburgh Honors College. I've taught collegiate and university level science courses for over a decade, including microbiology and physiology and pathophysiology. But the perspective I'm going to share with you is that of a high school principal, somebody who has had to deal with the quarantining phone calls and shutting down sports programs last year. I implore the board to consider the negative impacts that keeping kids out of school will have on them this year. Any opportunity to minimize students' quarantines and maximize their time in school, in athletics, in the arts programs that they care about should really be the primary goal of the school board's decision-making processes. And also, even though I have that background in science education, I would never declare myself an expert. And I warn the board against taking the opinions and positions of individual experts into their decision-making processes. Rather than looking towards individual experts, look towards the consensus of experts. The American Academy of Pediatrics, the American Medical Association, the National Association of Allergy and Infectious Diseases, the National Institutes of Health, the National Institutes of Allergy and Infectious Diseases, all support the Centers for Disease Control and Prevention stance that masking is important in schools to keep as many kids in school as possible. Thank you.
My name's Matt Bonnety, and I live at 862 Hershire Drive. I'm no expert, but this lady is, and I just want you to hear what she has to say.
Is that appropriate?
Masks. I applaud the parents who've done their due diligence. I'm going to tell you a little bit of my background. I have spent the past 19 years working the field of occupational and environmental toxicology as a senior industrial hygienist. I am cross-credentialed in public health, decontamination site management. I've had an infection control and prevention committees, infection disease committees in hospitals. In fact, hospitals cannot be built like if you have new construction, because I spent most of my career in healthcare. They cannot build a building without consulting with an industrial hygienist. Why? I'm going to explain it. So you have to understand my frustration. So I'm glad it went last because then I can address some of the fear that I'm hearing and the misinformation. I'm going to give you some credit for the fact that you haven't heard of my profession, most likely, because the media has the MDs and the DOs and the nurses on TV. They are skilled. They treat people. I protect people. And I train those doctors that are on TV, and they are not telling you the truth. The doctors that are telling you the truth, by the way, are here in town, the frontline doctors, neurologists, pediatricians, the ones I work with around the country are here this weekend at an event. And we are trying to let all the superintendents know, all the staff know. I understand you've been led wrong. This is not political for me. I'm a military veteran. I spent 9 years in the Air Force working in bioenvironmental engineering. Those burn pits you heard of, we air sampled them. 9/11, we air sampled them. Tell me why now, during every previous pandemic, my profession has been involved with air sampling and doing risk mitigation, selecting the controls. Why were we ignored during COVID? That's right, because this is not about the health and safety. That's not my opinion, that is fact. Because the fact is, every single mask that someone has on this room has 0% efficacy. The reason I know that is because I am a court-credentialed expert. I have been on countless court cases over the past year, and I've won every single one.
That's 2 minutes.
That's all I wanted to say.
All right, Kathleen, are you there?
Okay. Yep, I'm here.
All right, perfect. We'll try this again. State your name, address, and you have 2 minutes.
Okay. Kathleen Kroll, 2211 Milford Drive. First of all, I just want to say decisions about children's health and safety shouldn't be a popularity contest. No one expects the board to be medical experts, but we do expect you to look to the medical experts for guidance on medical matters. And as you know, all the major medical groups in the country are recommending universal masking of schools, or of children in schools. My main reason for calling, though, was to speak for my daughter. She gave me something to read. She is on her way home from Power Talk football. So if anybody on the board wants her email or phone number to verify that, that's fine. I'm happy to send that to you privately. Anything, this is what she wanted to say.
I'm here to speak in favor of universal masking in the schools. I don't understand how someone's ego can be so important that they continue to allow it to harm their family, friends, and even their children's education. I attended school from home last year, and it was brutal. I'm a good student, but it was hard to keep up, even though I know my teachers were trying their best. It just isn't the same. I'm an athlete, and soccer games were canceled, and I had to miss track meets due to exposures. Friends had their plays and trips and other events canceled. And yet you're willing to allow 2020 to repeat itself. Some of your own children had to learn in a totally messed up situation. Stop extending this mess. Most of the schools around us are wearing masks. A mask is not a big deal compared to real suffering. Hate the mask, hate the government, I don't care. But making everyone wear a mask in school will help decrease exposures and let us be safe. Please don't take another year of school away from hundreds of us. Thank you. And she's actually right here. She just walked through the door.
Hello.
Are there any more phone comments?
Yeah, we got a couple.
Okay, so at this time, then, the comments are over?
No. I said we got a couple. Yeah, we got quite a few.
Oh, there are two more?
Quite a few.
Oh, I thought you said there are no more.
No.
I'm sorry.
That's okay.
Go ahead.
Lisa
All right.
Slowinski, 1612 McCully Road. I am saddened by what I see on a regular basis in my community, around the state, and around the country. The division, everything is hurtful. But I come before you again tonight to remind you that as public servants, you took an oath of office to uphold the Constitution and Bill of Rights, the supreme law of the land, our God-given rights to life, liberty, and the pursuit of happiness. Our rights do not end where fear begins. Our rights are not suspended during a pandemic. No school board has the legal authority to coerce compliance for children to wear a medical device that could have negative physical, psychological, developmental, emotional, and social consequences. If you're going to act in this capacity, you're required to obtain informed consent. Informed consent means that you're required to provide the benefits and risks of said medical intervention. This consent must not be obtained under coercion with no punishments or rewards as a result. Where is the right to decline? We have a right to make our own medical decisions. We choose what we put in or on our bodies. 1,400 kids were quarantined last year that never got sick. That's a lot of kids. No school board has the right to quarantine a healthy child, let alone just unvaccinated or unmasked children. That is blatant discrimination. Please be advised that you cannot cite your legal authority for forcing medical interventions upon your patrons without a medical license, insurance, or training, and without the consent of the patient. You may be liable for one or more of a series of torts, including, but not limited to, assault, trespass, civil rights violations, violations of the Patient Bill of Rights.
Ma'am, can you finish up, please?
Violations of OSHA safety regulations and the adverse health consequences resulting from the conduct.
Thank you.
We, the people of Bethel Park, are
Please
prepared to
finish
serve
up.
lawful notification, follow the vote this
Ma'am,
evening. Please do
please
what is
finish
right
up.
and uphold the laws.
Okay, John, are you there?
Hey there, can you hear me?
Yes. State your name, address. You have 2 minutes.
Hey, my name's John. I'm on 3340 Crestview Drive. I usually don't talk at this sort of thing or get involved in this, but I tuned into this for the entertainment value, and I can't believe I've just watched 2 hours of, whatever side talks, it sounds like craziness, no matter which side of the two's at the podium. And I think it's time for some reasonable thoughts here. So let's look at some basic facts, okay? 1, vaccines work, and they work great. 2, masks work. But 3, and this is why I suggest you make masks at least optional in some settings, we have to stop this at some point. We can't keep living in this reality forever. I think a reasonable point to stop this is where perhaps everyone in this particular school has the opportunity to get vaccinated. Now, with the 12-year age requirement to be vaccinated currently, that lines up really well with IMS in the high school. Pretty much everywhere there can be vaccinated. And looking at Neil Armstrong in the elementary schools, they can't. So maybe masks should be required in, say, Neil Armstrong or the elementary schools. But I find it ludicrous asking students, many of whom I know chose particularly to get vaccinated so they wouldn't have to wear a mask in school, to have to wear one in the high school where everyone is either vaccinated or has had the opportunity to be and chose not to. That's ridiculous, and that shouldn't be the case. Thank you. I urge you to at least amend the current resolution or to vote no.
Well, it's the night before school, and I'd rather be home with my kids reading them bedtime stories.
Can you please state your name and address?
Well, I just wanted to say that. Okay. 880 Hershire Drive, Holly Lissack. Third time at this, and my story has not changed. My child goes to Neil Armstrong. He is now heading to IMS. Last year, he obeyed the rules, and he did wear his mask. He has allergies. He got bad headaches, and it was giving him problems. He got sent to the principal's office because he took his mask down to breathe, okay? He needs fresh air, okay? He has allergies, and it was giving him headaches wearing the mask. So I'm gonna have to get a pediatrician's excuse for him not to wear this mask. We're struggling in my home. And my little boy that's in third grade heading to fourth at George Washington, he choked on a grilled cheese in the summertime. Last month. He's only now starting to come around and eating food again. We've struggled this summer. We missed our vacations. So my kids mean the world to me like every child here means to you. We are in a really rough situation here, but it has to be optional. My kids aren't wearing their mask. One feels like he can't breathe, and the other one has allergies, and he asked me if he had DIPG like Joey Fabus. Joey's my neighbor. I love Joey. My little boy does not have DIPG because he was getting headaches in the back of his neck. I said, no, honey, you don't. I said, you're having headaches because these masks, we're taking them off. All summer without the masks, fresh air, wonderful. Indoors, fresh air, wonderful. No headaches, we're good. So masks should be optional, up to each parent, what's best for their child, because they know best, they live with their child. Okay? And there were parties in Bethel Park all summer long with all these kids. I've seen lots of parties on Facebook. Oh yeah, a lot of parties, a lot of parents without masks. Interesting. Popsicles on the playground yesterday at George Washington, okay? And of course it's outdoors, right? But they're congregating. All kids are congregating. They do that. And it's fun, and it's the thing to do, right? Let this be optional.
Please.
Let's stop this madness.
Please finish
Thank China for what they've done, okay?
Please finish
I'm
up.
done. I'm done.
Okay.
Hi, my name is Mary Alice Hodson, and I live on King School Road. I'm here to show my support for universal mask wearing for anyone inside Bethel Park schools while there is a high transmission rate of COVID infections in Allegheny County. Thank you.
James, are you there? James?
Hello?
James?
Yes.
Can you state your name and and your address, and you have 2 minutes?
Yes, my name is James Hill. I live at 2019 Millennium Court. And the reason for the call-in is between this meeting and the last meeting, there seems to be a lot of things that are based on what ifs. What if this happens? What if that happens? And anybody who's ever worked in any kind of company, corporate type of structure, you can't run a business, nor could you run an educational system based on what ifs. What it comes down to is people should have the choice. They should have the choice to either wear a mask as an adult. Their child should have the ability, if they want them to wear a mask, or not to wear a mask. The people on the school board you're making a decision based on the overwhelming number of people within the community who are for choice. This isn't a decision based on the school board's personal preference of whether a mask should be worn. And I think that needs to be disconnected here. There's many studies, and obviously not enough time to go through, where face masks really have little to no effect. May 2020, US CDC found that face masks had no effect, neither as personal protective equipment nor as a source of control. The European CDC, February 20 of 21, found no high quality evidence supporting effectiveness of non-medical and medical face masks in the community. And the list goes on and on and on. Last year, 1,400 children were put into quarantine. Obviously, we haven't heard anything in terms of did any of those kids wind up in the hospital, which seems to be not the case, because I think that would have made front page news here in Bethel. Even some of the adults who were quarantined, who worked within the school system, no hospitalization.
You're at 2 minutes. Can
no
you please finish up?
Well, the thing is, I'm in favor of having an option, and I think the board should basically make that that decision based on what the community is saying and not their personal preference. Thank you.
Thank you.
Brian Hosco, O'Neill Drive. So as you guys get close to making your vote here, I guess I'm curious what the motivation is for each of you as you make the vote. You know, is it because you think the masks work? You understand we're not dealing with little surgeons here with N95s, and you understand the behavior on how to keep the mask clean and that sort of thing. Some of these kids have had the same sock on their face since April, okay? Like, these parents get canonized for, you know, they just do everything they can to help slow the spread, right? These kids don't have the behavior to treat the masks as they should. The masks are filthy, they're disgusting, it's a joke, they don't work, and you all sitting up there buttoned up with your masks on, this is all for show. All of it. Is your motivation the quarantine rules? I do think it's worth the explanation to us parents how the quarantine rules are set up. We should be aware and understand that if there is an increased chance of missed school, if you aren't wearing a mask due to the quarantine rules and how they're structured, it's a valid point. But who should make that decision to weigh the effect of the mask on one hand for the kid versus the thought of missing school potentially? You think it's you that should make that decision, not me. Or is the motivation a big CYA effort where you're afraid to get sued if somebody gets sick, so you feel personally safer as a board member not daring to go against the mainstream talking points and just falling in line with everybody wearing a mask, right? So I'd have to ask you, has anybody ever thought of being sued the other way? I mean, not allowing the parent to be responsible for taking full responsibility, voluntarily taking full responsibility for the decision and not allowing us to make the decision. If one of these people here wants to wear a mask or 3 masks or 5 masks or show up here with a plastic bag over their head, I don't care, right? It doesn't matter to me at all. They can make their decision and I can make my decision, right? And I just have to ask you, what makes you all so arrogant to think that it's your decision? It's not your decision. Like, that's it. It's not your decision.
Nathan Chaffin, King School Road. First of all, I'd like to thank each of you for the work that you put in to protect and educate our children. I appreciate that. I think that one thing we can all agree on, I certainly hope we can all agree on, is that we want Bethel Park students and teachers in school, in person, and healthy for as long as possible. Now, I'm going to appeal to you, come from a place of practicality. What do you think is going to keep Bethel Park's kids and teachers in school and healthy the longest? Masks or no masks? What will happen this year with the even more contagious variant from last year? All but one of you is wearing your mask up there, for heaven's sake. Doesn't that say it all? Zip
Please.
it.
Go ahead.
Please.
You may leave.
I think you believe.
I'm
sorry.
If there's another outburst, you will leave. Go ahead.
You say rowdy, I say rude.
Please direct your comments to us.
My apologies. All but one of you is wearing your mask up there, for heaven's sake. I think that you believe in the efficacy of masks. I'm here asking you to impose a mask mandate to help keep our students and teachers in school, in person, and healthy. Thank you.
Thank you.
Brian, are you there?
Yes.
Okay, state your name, address, and you have 2 minutes.
Brian Calhoun, 5827 King School Road. I'm calling again to express my wish to allow masks to remain optional, as you've decided multiple times previously. That's all I have. Thank you.
Hi, my name is Amy Wagaman, Hillard Road, Bethel Park. I am a registered nurse. I have my master's degree. I have a background in critical care and infectious diseases. I just think, along with the other side, we want what's best for our children. We want them to remain in school. I question where the flu has gone, why everything is being labeled COVID, and I have seen that as a nurse. We have no flu coming in. We're talking about cases, and they're based on faulty PCR testing, running 30, 35, 40 cycles. A case does not mean it's an active infection, and I think what we're questioning too is what is the end game? As the mom before me said, COVID isn't going away, the flu doesn't go away. We don't act like this for the flu. We're just asking to have a choice. If people want to mask, we can respect their choice, they can do it. A lot of this just doesn't make any sense to me, especially as a medical professional. So I just, want to put that out there and just ask and say, you guys can't keep up with the CDC guidance that's coming out. We can't. It's enough to make your head spin. They come out with something new all the time. And a lot of these studies, why are we not looking at where the funding is coming from for these studies? Why are we not looking at top donors like Pfizer for the American Pediatric Association? We need to be discerning. We need to have wisdom. We need to have choice. So thank you, Mr. Spikuza. Up there without a mask. Thank you.
John, are you there?
Yeah, this is John. My question goes
If you can
directly to
state your
Joe.
name and address. Hello? Okay, he hung up. Oh.
Hi, my name is Brian Dougherty. I'm on Greenwald Road. The guy that called earlier was pretty interesting. He said there's like some insanity. It's been a year of insanity. I saw a picture of the side of a box of masks, on the internet, and it said something along the lines of not effective against viral spread. But you can't believe what you see. So I've been working from home most of the time, but I can go to my office. And when I did, out of courtesy, we have hand sanitizer there and a box of masks. Out of curiosity, I pick up the box of masks, blue mask like you're wearing. It says not effective against viral spread, and you shouldn't wear it for more than 30 minutes. And then you look around and you see people wearing masks made of socks, t-shirts. There's a guy here earlier with a ski thing. They're not effective against anything. And if this were such a massive thing, this pandemic, the masks that you're wearing, shouldn't we be disposing of them in like a biohazardous container or something? I see them laying around. I see them hanging on people. My son has them hanging from his dashboard, for God's sake. People throw them in their pocket. I have one in the center console of my car that's been there for months and hasn't been washed probably in 8 months. This is reality. You can say who all you want, but it's reality. Seriously, like this is insanity. Do you know how many people under the age of 18 died in Pennsylvania since this started from COVID? Do you know how many? I searched all day today, half the day. Pennsylvania, Allegheny County, CDC. I came up with a number, you know what it was? It was 0. 0. Under the age of 18 in the state of Pennsylvania have died from COVID-19 since this started. 0. What are we doing? What are we doing?
Okay, thank you, sir.
Rose, are you there?
Yes, I am.
You can state your name, address, and you have 2 minutes.
Okay. My name is Rose Rogers. 1236 Cobblewood Drive, Bethel Park.
Go ahead.
Okay. I'm sorry for some that feel like threatening the school board is the right thing to do. I'm for the mask so that all our children have the best chance for staying in school to receive an education and not to have a revolving door with kids in and out of school being left to teach themselves. I believe that we do all have rights, but I think we have rights as parents to do what's best for our children. Why would you want to expose your child to COVID when you don't know what this virus can do to a child years down the road? We have no evidence of that yet. I believe that we have the responsibility to keep our children safe from this COVID variant, this Delta variant, until we can get a better handle on that and get more kids vaccinated and get vaccinated at younger ages. I do not want the COVID vaccine or the COVID virus in my home. I have 4 small children that aren't able to be vaccinated, and I think the mask mandate at this time is the best way to go. Thank you for your time.
Eric, are you there?
Yes, I am. Thank you.
Yeah, please state your name, address, and you have 2 minutes.
Eric Zerlo, Claytonia Drive. Thank you. I want to first thank everyone for being here tonight. I know you have a tremendous amount of work in front of you. We moved to Bethel Park after careful consideration of what would be best for my family with our 6 children. The schools tipped the scale 100%. The community, the park, the outdoors, the recreation was all a bonus, but it was the schools. We know that COVID is here, and we've seen it take its toll on our family by the passing of loved ones and our friends, and some that are currently now struggling for their life. It's a reality. The quickest way to what we may call normalcy is by protecting our children and ourselves and the communities, and especially our students, from the continuation of the spread of COVID. In my business, I spend my working hours looking for flaws in large organizations in their crisis management plans on how they can best avoid crisis and still maintain the ability to conduct business so that the consumers can continue to have access to services and products in the face of a crisis or catastrophe. I see flaws in giving in to what we call caution fatigue. It's very difficult to stay hyper-vigilant for so very long. Everyone wants it to be normal again. We certainly do. But this is the new normalcy that we see. Life is ever-changing, and I believe it's imperative to teach our children how to learn to adapt to the ebb and flow in life while protecting them as they can't protect themselves. If we want to see the number of deaths under 18 to remain zero, then we need to have masks mandatory when we open up the doors for those that we're here to protect. So please, vote for mandatory masking in our schools and help us protect our children. Thank you.
Are you there? The system did not pick up your name.
Nick Walsh?
All right, if you can state your name, address, you have 2 minutes.
Yeah, sure. Nick Walsh, 588 Bryan Drive. Good evening. I don't want to be an adversary to anybody. I respect everyone's views on their kids. Everyone wants to think for our kids, just like all of us. I have some different talking points prepared, but most of it especially been said. Overall, I'm most concerned about the psychological and development impact of kids more than I am on the COVID impacts of kids. With that, there's a lot of signs and kind of that are showing that there's depression and anxiety amongst youth is on the growth. The reason this is such an issue is I think both sides have their political talking points, and there isn't a conclusive science and conclusive reason behind the mask. And I respect everyone's views, and a lot of people can say that, you know, some mask is better than no mask, but most of the masks that these kids are going to wear would be equivalent to something that's going to stop ragweed, which is like 250 to 550 times the size of a particle of COVID. So, you know, when I think about some of the other issues we have here, I wish we were spending more of our time in these last two meetings focusing on things like temperature checks before the kids come in, or improving our air purification systems, or improving the health and wellness programs within the school, rather than focusing on something that we're kind of being put into from a political standpoint that really is focused more on masking. And if this was the absolute answer, and we had a huge majority that was saying it, I would be all for it if there was science that was showing it. But you can literally go to half of the room and look back and forth and you say that this isn't definitive and this isn't the definitive thing to help our kids. I'm 100% for keeping the kids safe, and I want the best for all of these kids. I want them to all get a good education. I think we just have to back up and say, like, is this meeting or the last meeting, is this the best use of our time? And I understand what we're trying to get at, but I also think there's maybe other ways that we can get to the right answer and trying to protect these kids and getting them in school full days. And it may not be—
You're at 2 minutes. If you can finish up.
Overall optional. The last thing I would say is the district does not have our permission to test our kids at any time. And I think that's something that should be discussed at the next board meeting, because I don't have a full understanding of that. Thank you for your time, and have a good evening.
Christina, are you there?
I am.
All right, if you can state your name and address, you have 2 minutes.
Absolutely. Christina Bell, 2810 Poplar Street. I'm calling in favor of universal masking. If we want our students in school, the science proves that the only way to do so is with a mask. For instance, in Kansas, they did a mask optional in the schools. They started on August 19th. As of today, there are 23 active cases in students and 4 staff, and over 3,000 students are in quarantine. On Tuesday, just yesterday, the board has changed to mandatory masking. In Lake County, Florida, 90% of the 6th grade students are quarantined until September the 7th. A 12-year-old boy in Texas, only a few days had COVID, tested positive, and died. Is it going to take children in this district dying for us to realize that this is serious? Universal masking works. The science proves it. The American Academy of Pediatrics recommended it, and not all of our students can be vaccinated at this point. I believe the only way to do this with a full year in school is to require masks for everyone. Thank you for your time.
Carol, are you there? Carol? Hello?
Hello.
Can you state your name, address, and you have 2 minutes.
Sarah Lakin, 4942 Linda Drive. My philosophy is at this point that I respect everybody's choice to mask and to unmask. However, if the kids who are masked and they have to quarantine and they're forced to have to do asynchronous learning, I think the district needs to turn around and take another look at that. My biggest concern is that all kids get a full education this year, 5 days a week, in school and in person. If you're going to vote for no mask, then you need to come up with a better program for whenever the kids have to quarantine. Because telling them they need to sit at home and learn these new things that they're being taught by themselves for 2 weeks is unfair. If they're going to be able to stay in school longer and get 5 full days of education for the entire 9 months by wearing masks, then have them wear masks. My biggest concern is a full educational year after a year that basically they only retained probably 50% of what they were supposed to retain. So if you're going to vote that way, then you need to fix what's going to happen to the kids who are quarantined. End of story. Thank you.
Hi, good evening. My name is Robert Faber. I'm with Cross Run Drive. I didn't plan on doing this tonight, but thank you for giving us the opportunity. I want to say maybe you guys need to look at a combined type of, rather no mask or full mask. Look at it as the kids sitting at their desks, they take their masks off. They walk into the classroom, they sanitize with a hand sanitizer. They're allowed to take their masks off while they're learning, while they're writing, while they're listening, while they're speaking. When they go out into the hallway to change their books, to talk to their friends, they put the masks on. It doesn't have to be an all or nothing. Maybe that's the way we need to go. You talk about kids not, participating in sports and stuff. I have who's going to be a 6th grader. He does jujitsu 3 times a week, and none of those people wore masks. He started in the school with a mask right after the school ended. Nobody was wearing masks. He played a basketball camp over the summer. Nobody wore a mask. He said, "Dad, I can't breathe with this thing on." I said, "Then take it off." Nobody else is wearing them. Okay? He never ended up sick. None of the other kids ended up sick. If you have a child that's sick, don't send them to school. Just like us as a parent, if we're sick, stay home. Okay? Look at an option to have masks on in the hallways and off in the classrooms and hand sanitize, in between. That's all I got. Thank you.
Sean, are you there? Hello? Sean? Okay. I'm going to hang up and call back. Franklin, are you there? Hello?
Yes, I am.
Can you state your name, address, and you have 2 minutes.
All right. Well, I'm not a science man, but I'm a little concerned about the dog.
Name and address, please.
I see him walking around outside, gnashing, and it's
Name and address, please.
quite a disdain. I won't stand for it.
Can you state? Okay, hung up. All right, Brian, are you there?
Yep, I'm here.
If you can state your name,
Brian Alston,
address, and you have 2 minutes.
255, yep. Brian Alston, 255 Horning Road.
Go ahead.
I was calling in because, this has gone on long enough now. This topic has become very sensationalized, very politicized. It's a shame that we can't listen to all the guidance that's coming in and trust it. I believe that there is one easy way to use common sense in this. If you look at the numbers and how they play out, and these kids are not vulnerable at this point. When you look at the numbers, it's a very low infection rate, very low hospitalization rate, very low death rate with this. This has gone on for very, very long now, and I don't think it's necessary to keep these kids masked. The masks say they're not effective, so it's all theater at this point. The people that are vulnerable are the older, obese, people that are, have comorbidities. They are vaccinated at this point, and it doesn't matter that the kids aren't. They don't have a huge risk of catching it, being hospitalized from it, or dying from it. So I really hope that you keep the mask optional. These kids need to grow up and have normal experience in school and normal lives. Thanks.
Rita, are you there?
Yes.
State your name, address, and you have 2 minutes.
Rita Slowey, 127 Old Village Lane.
Go ahead.
I am just calling to say that I believe that children should wear masks. There's a mother, and I don't know if anybody's aware of this, that died. She got COVID. Her kids go to school at St. Thomas More. She recovered from COVID, and 6 months later, she died of blood clots. So I think it's important that you realize not only are kids possibly getting sick, they can bring this home to their families and impact mothers, fathers, grandparents, etc. And you also ask our children to come to school to learn, and they're learning about science, and science is telling us to wear masks right now. So my vote is to wear masks.
Thank you. John, are you there? John? John? Okay, drop. Got one more caller coming in.
Can I pause after this one? Can we cut it out? How do we do that? Say that again. Okay. Should I tell him?
Hello, are you there?
Yes?
Okay, the system did not pick up your name. Can you state your name, address?
Melissa Whistle, 3289 E.G. Road.
Okay, you have 2 minutes.
I think it's just my personal opinion. I'm very sad for the children of our district. I don't feel that there is a good plan in place either way. We have to think about the kids that are being quarantined, who's deciding how they're being quarantined, who gets quarantined, and how they're supposed to teach themselves for 2 weeks at home. Last year, January through June, kids wore masks every single day. We still had kids home. We still had schools closed. However, on the other side of that, we had the remote option. Kids that were home had the option to tune into their class live. I don't see any of that in the plan. I just think it's sad and we're failing our kids, no matter which side of the fence you're on with a mask or no mask. And that's all I have to say.
Is that it? Okay. We're not going to accept any more phone calls at this time. Any more comments from those people in the audience?
Am I done?
You can go.
Thank you. Thank you very much. My name is Diane Scabaloni. I'm on Main Street. So I am really still taken back from the one caller that basically said, we don't get to choose. We don't get to choose the best care for our children. We don't, I mean, what else did he say? It was, and you know what was really interesting? Nobody clapped for him. I think we all understand that there was something very, very wrong with that statement. we do get to choose. I mean, we know what's best for our children. There are some, we can go on and on. We keep saying the same things over and over, what's happening here in our country. Where is the history lessons? Where are they for our students? Let's go back and teach them about America, where we came from, the God-given values. That's what we were founded upon. God, Jesus Christ. We need to go back there. Government took that out. Took that out of our school system. Everything got chaotic. You know? And that is where the foundation is. Let's talk about history also. Back when Rockefeller was here, the wealthy people, they dictated a lot was going on in our country. And he had a big part in taking out what we knew what was working, supplementation, eating right, because he knew there was money in the medical. And this is all on purpose. COVID is on purpose. What's happening in our country is on purpose. People getting divided on purpose. It all starts with the reverence and the fear of the Lord. And that's where we are falling in our country. That's where we're falling in this room. We got to get back to the basics. And I'm also curious to know, are we going to hire more teachers and more aides if the mask mandate goes through? Are we going to hire more people to watch every move that the children make? In the bathrooms, on the playground. It's already been said here. It's impossible. You're going to have to hire more people in order to make sure that these children are under control and they're losing their childhood, and it's sad. That's all I'm going to say.
Any other comments?
Hi, probably going to be the last one, I think. And I was not going to speak. My name's Mary Beth Zelt, 200 Iroquois Road. I'm calling, first of all, because the woman that just called in here and said that there was a mom from St. Thomas More that died of COVID is absolutely incorrect. I know the woman. She did not die of COVID. So shame on her for hiding behind that phone call and lying. My friend, I just confirmed with her, she's best friends with that mom who just passed away, and that is not how she died. What I would like to say is I'd like to piggyback on the few people that have mentioned an alternative to a no or all or none mask. I didn't even think about it myself, but could we start with the proposition of masking the kids in the hallways when they are more clustered together, and then when they do arrive in the classroom and they are supposed to be so many feet apart, that they should not be able, or they should be able to take off the mask so that they can see the teacher's face and the teachers can see them speaking and talking and smiling like they should be. I think that's an excellent idea. And I think that the board should definitely talk about that. The second thing I want to say is, when we finally did get back to school last year, my son, who was a senior, went to school for, I don't even know if it was a whole week. And he was 6 feet apart in the classroom. He wore a mask. I got a call from the nurse immediately and said he has to quarantine. Well, why does he have to quarantine? Because someone in the classroom was tested for COVID. Did the boy in the classroom have symptoms? No. Someone in his family had COVID. He didn't have any symptoms. He had to be tested. He had COVID. Now, my son and other boy had to be quarantined for, I don't remember if it was 10 or 12 days. That's ridiculous. So when we throw out these numbers of all these kids that were out of school last year for 2 days out of a week that they were there, wearing masks, sitting far apart, what's going to happen if we just do the same thing all over again?
Can you finish up, please?
Sure. I think we need to try something different because that wasn't working. Thank you.
Thank you. All right, at this time, we're going to move then to the business at hand. And our only action item is the revised health and safety plan. I need a motion to adopt it.
So moved.
Moved by Mr. Nagel. I need a second.
Second.
Seconded by Mr. Scalzo.
I move to amend the Health and Safety Plan, Section 3A, to state universal and correct wearing of masks will be required by all students, staff, and visitors when in district-owned buildings, structures, or transportation. Universal masking will remain in effect throughout the 2021-2022 first semester.
Did you get that down? Excuse me. Did you get that?
We need quiet out there so that we can move through this process properly.
Can you,
I would be happy. Would you like me to
Here's
read
the-
it before we do a vote on it?
we need to have a second.
Second.
Seconded by Mr. Scalzo. The motion under 3A has been moved by Mr. Nagel and seconded by Mr. Scalzo, and Mrs. Undel is going to read it again.
The health and safety plan on the agenda has been moved for amendment under the masking section to state as follows. Universal and correct wearing of masks will be required by all students, staff, and visitors when in district-owned buildings, structures, or transportation. Universal masking will remain in effect throughout the 2021-2022 first semester.
Discussion or comments on this motion?
I'd like to first say that this motion is to help provide the continuity of education based on the CDC guidelines to prevent our children from being quarantined for contact tracing, as many of us have discussed. As guidance changes, we may be able to revisit it. As circumstances change, we may be able to revisit it. One of the things that may encourage me to revisit it is if we get our vaccination levels up to what the epidemiologists recommend.
That's all, please.
But it is a living document. This is an evolving situation. But for right now, I am making the motion to carry it out throughout the first semester so we can focus on educating our children.
Other discussion, other comments?
Well, I just have a point of clarification. Are we voting on just making the change, or are we voting on the entire?
We're just voting on the motion right now.
Okay, just wanted to make sure.
Amendment to the health and safety plan under section 3A.
On the change? We're voting on it.
We're just voting.
Any other comments or questions?
I'd like to make a comment, and this is just reviewing the points that I made last week. I really haven't changed my mind on this issue. It's really the negatives of quarantining. It's, you know, I'm an educator. I've been doing it for a long time, and I've had a full classroom of students today, and it was truly an amazing experience to have that. Last year was a complete nightmare for many districts. Other things to think about: hybrid and virtual learning methods did not provide a high-quality education. Third, programs such as sports or music program, clubs, activities will be impacted because of quarantining. These are important outlets mentally, socially for our children, and should continue without interruption. Another point, economic hardship. If families at a moment's notice need childcare due to quarantining, I really don't want to see a family impacted in that way. Families were, though, last year. We're trying to not relive last year. Another point that I want to make, administrative teams for many school districts were weighed down with additional responsibilities tied to COVID. So I would rather have our administration focus their energy on educational goals. Our administrative team is a group of educational experts that need to provide an educational map for the staff. This will allow our children to receive a high-quality education. So tonight, I am voting for the stability of 5-day in-person instruction for masking. Thank you.
Other comments or concerns?
I have 2 points of clarification. On the amendment, this is for indoors only. So if they're able to go out for gym or out for lunch, the masking would be removed as long as they're social distancing, correct?
That is correct. That is how the motion reads.
Okay.
It applies only to district-owned buildings, structures, and transportation.
So, point of clarification again, then that includes sports?
Right.
Basketball's an indoor sport, so does that count?
Sports that occur in district-owned buildings would fall under the universal and correct wearing of mask requirement. However, the district would follow the exemptions that were put forth for athletics by PIAA and the other organizations that monitor your sports.
Any other questions
Yeah,
from
we
the
can't-
board members? Any other comments or questions
Yeah,
from the board members?
I have a whole problem with that whole amendment. You know, prior to coming tonight, I was all for this. I changed my mind. But, you know, 2 days ago, I was at Eaton Park, and I had like 20 band members come in with their orange shirts to eat breakfast, no one wearing a mask. They were in the mall. There were kids in the mall. Today, I come through the fields, and there's kids and parents and we went to orientation, no masks. But we're asking these kids to come and sit for 6 hours and wear masks in school. I don't understand that.
I can't.
But
that's enough. That's enough.
All right.
That's enough.
It's our turn.
If we have to recess and take everybody out of the building, we will do that. But we need to be able to conduct business.
And
Please
the other
listen.
problem I do
I can't,
have
we
is
couldn't
with
hear
the-
her because you were talking. Go
with
ahead,
the health
Mrs.
and
Roll.
safety plan. I don't understand why PDE is recommending us to take care of the academic side, but not the sports side. Where's the influence coming from? And we have to have the municipality for their recreation. What are they going to do? So there's so much inconsistency. I think at this point we should consider it being optional until some of these things can be ironed out or we get higher mandates.
Forget it. Just vote. Any other comments or questions?
Mrs. Dobus, I do have a couple comments. I think that, first of all, I speak for myself. I don't speak for the board. We always do that when we're here. We always are speaking our opinions. And someone said it earlier this evening. Where did common sense and common discussion go? Why can't we have a discussion instead of an argument? I don't know why, I don't know where, I don't know how it happened, but it's ridiculous. Let's get back to the point where we can actually talk to each other and not yell at each other. All right? It's ridiculous. I'm sorry, did I amuse you with that? I'm really sorry. You know who I really think is the culprit here? It's the organizations that we put our faith in, the CDC, the WHO. I'm not going to delay this evening by reading all these things. I'll give you the titles. I'll let you come up and look at the documents from them, directly from the CDC and the WHO. On the WHO, it says it's from their global influenza program, non-pharmaceutical public health measures for mitigating the risk and impact of epidemic and pandemic influenza. They did 10 RCTs, which if you listened earlier, RCTs are randomized controlled studies, not observational. 10 RCTs were included in the meta-analysis, and there was no evidence that face masks are effective in reducing transmission of laboratory-confirmed influenza. All right, now if we're supposed to put our trust in these organizations, they just stated that they don't work. And then their recommendation, face masks worn for asymptomatic people are conditionally recommended in severe epidemics or pandemics to reduce transmission in the community. Disposable surgical masks are recommended to be worn at all times by symptomatic individuals when in contact with other individuals. Although there is no evidence that this is effective in reducing transmission, there is no mechanistic plausibility for the potential effectiveness of this measure. So they just said that they don't work. This is from them. I'll be happy to share this with anyone.
Other comments or questions?
I have one more thing, Mrs. Dobus. I'm sorry. This is volume 26. Number 5 of the May 2020 from the CDC, directly from the CDC. I'm not going to read 7 pages to you again. If you want to read it, I'll be happy to share it. In our systematic review, we've identified 10 RCTs that report estimates of the effectiveness of face masks in reducing laboratory-confirmed influenza virus infections in the community. They did a published study from 1946 to July of 2018. In a pooled analysis, we found no significant reduction in influenza transmission with the use of a face mask. So That's who I blame. It's the people that we're listening to. We don't get one message. We get one message today, we get one message tomorrow, and then it changes, and then they move the goalposts, and we go all over again. I have other things I can read to you, but I'm not going to bore everyone with it. If you want it, I'll stay after the meeting, and I'll be happy to share it.
Other comments or questions?
Ms. Douglas, can you hear me?
Yes, we can, Mr. Christensen.
Okay, thank you. I had just a couple comments. So, you know, unfortunately, we're still talking about masks after last week. I think what's different this time for me is that it's actually not about the mask or the logic of masks or vaccination or anything like that. It's not about if they work or don't work. I kind of think they're like seat belts where they work some of the time, but not all the time. This is really about the way the quarantine rules are established and, you know, how they will be effective or prevent students from, you know, being in school if they're not wearing masks. I think that these quarantine rules have been developed deliberately to incentivize school districts to adopt masking policies. And about 4 to 5 months ago, we voted to have kids in school for 5 days a week, full in-person instruction. For me, that's the most important priority that we have in front of us tonight. You know, when you look at the cases last year, the number of cases, the number of quarantines with both all students wearing masks in and out of the classroom, and then also classrooms that were at partial capacity, this year it has the potential to be worse. And the thing that I can't sacrifice is not having kids in school or being sent home for 10 to 14 days to do remote learning from their homes. I can't buy into that. I also think that, you know, COVID's going to be around for a long time, probably a couple of years, with a lot of fluctuating infection rates. And we need to be thinking about what's our long-term policy for dealing with, and I'd like to see it based on metrics, and so that we know what to do when certain infection rates develop. So we can treat it more like a snow day rather than these kinds of events and these kinds of meetings that we have here. So I will be voting for the masks for right now. Okay, I don't necessarily agree with the duration of it, but we can address that later. But what I would like to see as an outcome of this is some form of a committee, maybe of local medical professionals who can address the health aspect, and district administration who can address the operational aspects of it, meaning, you know, how socially distanced are people going to be, what's the risk of people getting quarantined, and then based on metrics, we can adopt a policy that will allow us to change our stance, change our requirements faster as these infection rates fluctuate. Those are my only comments.
Is Mr. Christensen completed? Barry, are you done with your remarks?
I'm done with my comments, yes.
Thank you. Other comments?
Yeah. As I sat here and listened to everything, and, you know, I apologize, I was out away on work last week. I have 2 kids in this school district that one of them I'm probably not going to get to say goodnight to tonight before his second day of 2nd grade. The other one is concerned. She's concerned that she got vaccinated and she's going to have to wear a mask because her mom is concerned that she is going to come home, give it to her brother, and give it to her grandfather who will die. No, I'm not.
Don't engage. Do not engage.
So here's my concern. I want them in 5 days a week. I voted for that months ago. The only way to put them in 5 days a week is to mask.
I'm going to ask the audience, I'm going to remind you to keep to just stick with the board for just a moment. You will have another opportunity at the end of the meeting to comment.
Any other comments or questions?
You know what,
Turn it on.
last week, it was obviously something different than it is this week for me. When it comes down to it, I kind of look at what program are we going to put in place to get more rear ends in the seats in school. And we all agree that last year was not a very productive year for kids. With 1,400 quarantining cases when on the limited access to the buildings, it's just mind-blowing. And so, but I agree with Barry, taking a look at some type of metrics down the line, and if numbers improve dramatically, and correct me if I'm wrong, but if they do improve dramatically, we could call another board meeting and possibly amend. All right, that's all I have to say. Thank you.
Mrs. Dobus, I have one other comment. We already know that we're going to have at least the number of students out again this year as we did last year, as because if masks truly worked, then those kids wouldn't have been out last year either. So it's going to occur again this year. It is. It's going to occur. And the other point I didn't make earlier, I think that, and it's been addressed by several different people, any high school student or other student that's been vaccinated should have a different requirement than a student in the elementary. I think they should be treated differently. And the third point I would like to make is if we go back to the moderate rate in Allegheny County, are we still going to mask? Because that's really one of the driving numbers that we follow. Isn't that correct, Dr. Jansani? That's one of the numbers that really drives masking or potential masking. So that we're not going to take that into account either in this motion.
Any other comments or questions?
My vote hasn't changed, so.
Okay, at this time, I've had a request to have a roll call vote. And this is only on the amendment. And I would ask Ms. Zundel to read the amendment again.
Be happy to do that. Universal and correct wearing of masks will be required by all students, staff, and visitors when in district-owned buildings, structures, or transportation. Universal masking will remain in effect throughout the 2021-2022 first semester. And this is specifically amending Section 3A of the current health and safety plan of the district.
Mr. Pictionary?
Mrs. Dobus?
Yes.
Mr. Christensen?
Yes.
Mrs. Roll?
No.
Mr. McGregor?
Yes.
Mr. Modrak?
Yes.
Mr. Nagel?
Yes.
Mrs. Turner?
Yes.
Mr. Spicuzza?
No.
Mr. Scalzo?
Yes.
7 yes, 2 no's. Motion passes.
Thank you. Now we are going to discuss the amended health and safety plan and vote on it. It was motioned by the original motion for the health and safety plan was
It was Mr. Nagel,
Mr.
and
Nagel.
then by Mr. Scalzo.
This is the second warning for this group over here, and I will have the officers
escort you out. All right. Is there any discussion on the motion to adopt the health and safety? Are you leaving? Yeah, I'm talking to you. Are you leaving?
She is.
I know. My term's over in November, so. All right, so,
Should get the voter out.
okay. Ma'am, leave, please. Before I ask the officers, please leave. Now, you've had several outbursts throughout this meeting. I'm asking the officer to come down and escort you out.
Take a break. Take a break. No.
We haven't even voted, sir.
That's a shame that you should put him in that position. That's a shame. You should be ashamed.
Where we at?
Oh, especially you.
Excuse me, sir, would you like to be escorted out also? Okay, then I'll ask the officer to come down and escort you out. I'm asking you. I'm asking you. I'm asking you to please be quiet or be escorted out. And you said you wanted to be escorted out. I'm not threatening anybody.
Madam President,
All right,
move forward.
let's continue with the vote then. Are there any questions or comments on the health and safety plan as amended?
Whole plan.
Ms. Dobos, maybe Mr. Gensanti could explain the other changes. I think there was some minor changes to the health and safety plan in addition to this amendment.
He did. He explained that at the beginning of the meeting,
Okay.
Mr.
Okay,
Christensen.
Never mind.
I don't know if you had any other questions.
Any other questions? No.
From the board to me.
Well, the only other question I have is what I asked earlier. So if Allegheny County changes to moderate or even less than moderate, are we going to have another special meeting to address that, or are we going to somehow address it in this?
Right now, the problem is the requirements for quarantine. That's the problem. It's not, that's what we have to deal with. So right now, if a student is sick, then anybody around them without a mask, they got to quarantine for 14 days. That's the issue.
I get that.
It's not a negotiable piece.
No,
it's something we're compelled to do.
I understand that it's not negotiable. I just don't think it's a very, just because, so the kid with a mask on could be asymptomatic and still spread, so it's okay, they can come back to school for 14 days. I'm not blaming you or anybody up here. It just makes absolutely no sense. It's illogical.
So I do have a question about that. Any infectious disease, we have to report to the Allegheny County Department of Health?
We do.
And we're under their jurisdiction?
We are under Allegheny County, and they advise us and direct us. And as a school entity, we are compelled to follow whatever their request is, including correspondence to families and including if we have to up to closing school. Yeah.
So that the question about transmission or rates or anything else really is not an issue regarding this. The issue is that they have jurisdiction over us regarding quarantining.
They do.
Okay, thank you. Any other comments or questions? Okay, we'll have another roll call, please.
Mrs. Dobus?
Yes.
Mr. Christensen?
Yes.
Mrs. Roll?
No.
Mr. McGregor?
Yes.
Mr. Modrak?
Yes.
Mr. Nagel?
Yes.
Mrs. Turner?
Yes.
Mr. Spicuzza?
No.
Mr. Scalzo?
Yes.
7-2, motion passes.
Thank you. Okay, at this time we have public comments on any item that you'd like to address the board.
I'd like clarification on the exemption status of sports. So you are going to provide athletes who play indoor sports exemptions so they can be running up and down the basketball courts and things without a mask?
Some schools did.
I didn't totally understand that part. Please advise.
Do you want to answer it? You already answered it once. Go ahead.
The board president has directed me to answer that question. Just for clarity of everybody in the audience, the exemptions to masking do include if continued masking would cause an imminent health issue for a student who's engaging in some type of aerobic activity. Those are things that I know Dr. Jansani has worked with Mr. Sloan on consulting with coaches and individual athletes about what is required for their safety. And there are also medical exemptions for any student who has a documented disability that prevents them from safely wearing a mask, that they would be able to be exempt from that as long as they go through the proper process with the school.
Thank you.
All right, well, I'd like to thank the two people with common sense who voted the right way. The rest of you have failed us, and we will not forget this.
I have one on the phone. Oh.
I'd like you guys to clarify for me, just in case I heard wrong, what is the testing policy in the school for the kids? No, something was said about testing in the school. No one else is allowed in the room. Please elaborate on that.
That was regarding the
special ed evaluations.
I know. That was Mr. Dr. Jansani.
Yeah, that's particularly for students with disabilities. It's for testing for them. That's individual tests. That's not classroom
No,
setting.
I understand that, but so define disability for me where my potential second grader would be tested.
Well, there's a process involved in testing. That includes a request from the parent to the district, and there's a protocol in place for doing that.
So,
there's a time,
I'm sorry, go ahead.
There's a time frame, and all those things have to be in place.
IEPs,
Yes.
special disabilities.
Well, you have to qualify for.
So I guess what I'm saying is, under no circumstance will I ever find out that my second grader was tested in private one-on-one without my consent.
It takes the parent consent to do that.
Good.
Yes.
They're not talking about COVID testing.
I know.
I know.
Any kind of testing.
I know.
They're talking.
I would like to thank the
Yeah,
board.
the amendment is.
It's okay. Go ahead.
I'd like to thank the board. I recognize that you are all volunteers, and you have stepped forward. In
Just
the
real quick,
community.
I know that you guys have already spoken, and I should have caught that with the first couple, but we're recording it. Name, address. Once again, I apologize.
Nope,
I
don't
thank
apologize.
you.
My fault. Michelle Kramer, 3225 Arapahoe Road. I want to thank the board because I recognize that you are all volunteers stepping forward in what is clearly a very divided community to put the health and safety of our children. The desire to have our children in school 5 days a week is clearly forefront in all of your decision making, and I appreciate your time. Thank you kindly.
Hey, Nathan Grafton, 60 Surrey Woods Road. I just want to inform the board, there was a study done by the Institute for Pure and Applied Knowledge. It was peer-reviewed, published on October 12th, 2020. It showed that the number of deaths that were being counted for COVID was 16 times higher than it should have been if you use the way that deaths were counted for viral infection deaths for the past 17 years prior to this virus coming to our country. This is a complete sham. Yes, there is a virus out there. Yes, people are getting sick and dying, but it's being overblown, and the purpose of overblowing it is to take control of our country. These people out here, these globalists, China, we got a president who is completely complicit with what China wants to do to us. We see what's happening in Afghanistan right now. These terrorists are probably coming to our country. We don't know who is a terrorist and who isn't, who's on these planes coming here. We need to start fighting back against these CDC organizations. These are completely corrupt organizations, and what you're doing is you're playing their game, and you're just going to keep doing what they want you to do. You need to start fighting back. You need to start saying, we're not going to do what you want us to do. These quarantine guidelines are clearly intended to cause children to wear masks. You're causing psychological damage to our children. You're causing risks for health concerns with not breathing enough in oxygen. There's not studies done on that to show what types of effects that could have on a child not breathing enough oxygen in. And you're continuing this fear and this pandemic. You guys, it happens at the school board level. Those who didn't vote to not do mandated masks. Connie, thank you so much. Russ, thank you so much. You know, you understand the bigger picture. You guys need to get yourselves out of this small picture of, okay, we're just concerned about quarantining, and see what's happening in the country. It happens at the school board level. You guys need to stand up for us against all this corruption. You can't just look at the small picture. You have to start pushing back. Thank you, Nathan Graff.
Do you want?
Sharon Janisic, 4314 Anna Street. Thank you. I appreciate all of you. I appreciate the board, who are 100% volunteers. Thank you for taking on that role. And thank you to our administrative team, who got to be with us for another fun time this evening. We appreciate you as well. Thank you for prioritizing the in-person learning of every single student in Bethel Park. I appreciate it. It is what children need to learn. Thank you.
You want me to work in?
Go ahead.
Andy, are you there? Hello?
Hello.
Can you state your name, address, and you have 2 minutes.
My name is Cindy Fabus. I live at 844 Hershire Drive. I just want to say that to start, I am a supporter of wearing masks. It does mitigate risk. However, it is not a perfect science at all. I wear masks at work, but until the state decides that we have to wear them, we all have to kind of not push our decisions on each other and our opinions. We all have situations right now where it's required, in some places and not required. I will support the decisions that are made and make decisions for my own family. What I want to bring up right now is that I had heard a comment earlier today about DIPG and a parent's concerned over their child potentially being concerned over contracting DIPG. Although this may not be the appropriate place to say this, I don't appreciate my son's name being brought into this meeting. If anything, somebody who is a supporter of not wearing masks should be supporting masks wearing just because of cancer patients alone. That being said, I have not gotten involved in all of the meetings. Basically, I've listened to them, but I didn't want to get on and comment. But after his name was brought up, I wanted to clarify that I am not support of his name being brought into this situation, and I will support the decisions made without negative comment, and I will make decisions that are best for my family based on my own opinion. Thank you very much.
I think they can hear better out in the audience than we can hear here.
Lisa Slewinski, 1612 McCully Road. I respect that you all have a very difficult decision that you had to make this evening. I think everybody here in this room wants what's best for each child, but they each have to make their own decisions. They have to base this on everything that goes on with that particular child. You have no idea what's going on with all the children out here. I mean, there's a lot of kids that cannot wear masks, and forcing them to is almost akin to child abuse. You really have to think about what you're doing to these kids. You should be giving them a choice. The science has been proven that masks are not preventing the spread. I mean, we would be done with this after 1.5 years now if masks worked. Everybody's been complying for this long. And now here we are with round 2. We're going to end up with round 3. We're going to end up with round 4 as long as you keep complying. The CDC does not make rules. The WHO does not make rules. Allegheny County Health Department does not make rules. The governor does not make rules. The only people, or laws, I'm sorry, the only people that make laws are the legislators. Now, you are not even bound to follow all of these regulations. You need to make your own decisions and have free thinking. You know, you need to do what's best for the children, not be stuck with these regulations because the CDC said them. You're not bound by that legally, just because the CDC said it. They don't make a law. But I do have here lawful notification that the people of Bethel Park have supported. I have 10 pages of names. I will send it registered mail, but I do want to present this at least to you so you can see this.
Hey, ma'am, will you finish up, please?
Because they are, everyone here is concerned that all of our rights are being stripped away, and they do want to retain those.
Brendan McCarthy, Jordan Street. You guys were put in an impossible position, and you were put in that position by our higher up elected officials who didn't have the political will to make the right decision. And I thank you. I thank the 4 of you that did it last week, and I thank the 3 of you that came around this week. I'm a public education guy, and my daughter was enrolled in Catholic school until we got this vote. And I just want to thank you for letting me send my daughter to public education. Thank you.
Wait a second, sir.
Phone call real quick. Dan, are you there?
Yes, I'm here.
State your name, address, and you have 2 minutes.
Dan Grisbeck, 2763 Milford Drive. I just wanted to thank the 7 board members who made the decision that supports the health and safety of the children of Bethel Park, as well as the faculty of Bethel Park, and we'll keep them in the classroom. Thank you.
Matt Bonity, 862 Hershire Drive. I played you 2 minutes of a video that I sent you all to the BP board email address. I implore you to watch the entire video. It's a 5-minute video. Just go into it with an open mind and watch it. The second thing I want to say is that I cannot believe the hypocrisy of what it is that you're saying to us. You're telling us that kids can go and be as close as, right next to each other, playing sports, sweating, wiping their face, wiping their brows. They can be asymptomatic. They could have the virus, whatever, but they can do that. That's what you're saying. It's okay for them to do that, but it's not okay if they don't wear a mask and they're 6 feet apart. What? Did you just hear that? Seriously, I'm not trying to be a know-it-all. I'm not a professional in this. I sent you a video of somebody that's a professional in dealing with this stuff, okay? That video is of somebody that's not a pediatrician. She is not a doctor. But her job deals with this exact thing. She's the one that is out there teaching the nurses and the doctors. She's the one that's out there providing what is needed to even build a new hospital. Take the 5 minutes. Listen to the video. Then listen to the hypocrisy of what it was that I just said. If you can let this happen for sports, you can darn sure let it happen in a classroom.
Do you have somebody or am I good?
No, go ahead. You can go and then I'll go next.
Sherry Wetzel, 375 Dale Road. I came up here, Tuesday and again tonight and asked if you could make those masks optional to stick to originally your plan. Tonight just literally showed me, and it will show my kids, that they can't depend on their own school board. You guys, it was black or white for you. And the amount of comments that you got from the other side flipped your votes. Just like that. There was no gray area. You got high school kids that you know as well as I know don't wear those masks properly. You passed a plan for masks being worn properly. Not a single child in those schools wear masks properly and stay 6 feet away from each other. My son plays football. He doesn't wear a mask. He wrestles on the ground. They were able to roll around all wrestling match, but not able to shake hands. No law after a match. There is no logic, none. And I asked this board to show some logic, and you failed us. You failed 3/4 of the school district that asked you to leave a mask, our decision and our choice for our kids. Because I have one child in the high school that is fully vaccinated that had COVID, then got a quarantine, right? The first, you guys, the school told me on the 1st, on the 8th, he was told that he had to quarantine for 4 days. He could come back to sports before I could bring him here for school. The logic is gone. And you guys, you just helped along to it. I hope you're happy with yourselves.
Thank you.
John, are you there?
Yes, I am.
Oh, go ahead. You can state your name, address, and 2 minutes.
Dawn Cicero, 2518 Oldfield Avenue. Most of you claim to have voted tonight based on the quarantine guidelines, which I totally understand. We all want our kids in school 5 days a week. But you have yet to address the actual full guidelines dictated by the CDC, whereas a fully vaccinated person does not have to quarantine unless they are showing symptoms. So I urge you to add this to your health and safety plan. If in fact you're basing your decision on the actual quarantine guidelines, it's neglectful not to consider the fully vaccinated kids. Also, why can't we implement a choice for a quarantined child to produce by their own choice a negative COVID test so that they don't have to be quarantined for the full 2 weeks? There are incentives that can be put in place. We do have a choice here. We can do better for our kids, and I urge you to rethink this and come up with something better for us. Thank you.
Go ahead, ma'am.
Jewel Corbel, Boxer Drive, Bethel Park. I just wanted to address a few things again. At the last board meeting, I can't remember what the actual number was, but the ventilation for our classrooms was saying it well exceeded to give the fresh air to the children that were sitting in the classrooms, which leads me to believe that really we should consider their classrooms almost like they're outside first. When we say that the 1,400 kids that were quarantined last year, and we don't have a number of the kids that were actually sick, that doesn't sit well with me either, because even if they went home asymptomatic, if they became symptomatic and became sick, I would believe that the parents would have taken these children to be tested, which then that result would have gone to the health department. It would have become the statistic, and that would have then been brought back to you through the whole contact tracing that we're supposed to be doing. The other thing is, like we keep saying, our children are playing sports. They've been together all summer. They're going to go outside. If they're in the classroom, like I say, this ventilation is exceeding. They're sitting at their desk. They're not sweating. They're not, throwing droplets everywhere to sit at their desk. They are coming to school. They need to see faces. They need to have the emotion. They need to see what is going on. The teachers need to see that emotion, not a mask. It's been proven that masks aren't a true source to take this. This is still a virus. It's the new virus. This did become a political virus. It's like influenza. Like I said before, viruses run their course. This and everybody goes to the vaccination, which there's been no controlled studies. The population is the human trial. There was no animal trials. We have no idea. They now have pregnant women volunteering because they're being paid to see if this vaccine is going to affect their fetus. But the recommendation is that even the vaccinated population needs to wear a mask. My last statement, I know I'm at my 2 minutes, my last statement is, our original health and safety plan said that we were going to remain optional for the parents unless a government mandate came out, and we have no government mandate. I don't know why we're at a second meeting to readdress this.
Thank you, ma'am.
Ian Phillips, Macaulay Road. I requested the school board to meet next week to amend the health and safety plan to make masks optional. Next week. Let's meet again. Do it again. Sounds good, right? We can do it. You guys had the plan on September or July 12th. You guys voted 8-1 to make masks optional. The common sense plan. Mr. Nagel, you made that motion. You motioned that plan. It made sense. Common sense put the control in the parents to decide what to do with their children. It was approved 8-1, full board. Why are we here last week? Why are we here this week? So let's come back next week. Or do it 2 weeks. Do it professionally. Put it in the paper. 2 weeks. Let's do it. Does that sound like a good plan? Is that fair? Because we're going to keep doing this and doing this and doing this until when? When is the end game?
It has to be the night before something important.
We already got the call.
Do we have any more phone calls?
Yeah, we have one more.
Did you say one more?
Yes, one more.
Okay.
Tiffany, are you there?
I'm here.
Go ahead, state your name, address, and you have 2 minutes.
Tiffany Phillips, 6030 Oak Park Drive. I just wanted to thank you for your service. I certainly don't envy the position that you're all in. I have 2 children in the district going into 4th and 6th grade. I can tell you that tomorrow, whether they wake up and I tell them they have to wear a mask or they don't, they're not concerned with that. They want to go see their friends. They want to go, they want to be in school, and they want to learn. So I really want to thank all of you for prioritizing in-school learning for my children. And then I also wanted to thank Mr. Nagel for his comment of the economic impact. As a single mom, I've already had to make a lot of concessions for my job. And it's not easy to have to try to teach a 3rd grader at home when you're also trying to work. So I thank you all for your service. Thanks.
Okay, that's the last comment on phone calls. We won't be accepting any more phone calls, but we'll continue to listen to in the auditorium comments.
Hi, Christina Headley, 5881 Irishtown Road again. Thank you. I know this is difficult. It's tough. It's rigorous. You've spent hours, and I'm sure you've read a million emails and everything else. It's not an easy choice. But someone did mention that if anybody with a medical background would like to help with the health and safety plan, I'm volunteering. I had emailed the board my last meeting. I had requested that I would be open to that, and I will be. I can email my contact again. I can talk to you after the meeting. But I would be very interested. I do that every day, and anything that I can do to help keep our kids in school and to keep the school from closing, because not only, yes, the masks do assist with that, but the kids have to wear the mask properly. There also has to be social distancing, ventilation. There's multiple factors. It's not just one or the other. So I'm willing to help, and anything that I can do, please let me know. Thank you.
Thank you.
This is Brian Lynn, 780 Greenhaven Drive. I just kind of was sitting back and watching this all, and it's kind of scary to me that this is all about choice, and there's people who want to force their will against others, and there's other people who want a choice. And this is what it is. We all want a choice. And so when you guys are going to come back, because at some point, I think you guys are all going to be sitting up here, and you're going to be voting that there's going to be mandatory vaccinations for children here. And if your children aren't vaccinated, What are you guys going to do? You're going to send some kids who aren't vaccinated to William Penn, and then you're going to send some kids to this school. And until everybody's vaccinated, then we can bring everybody back together. It's a bunch of crap, honestly. Like, get your heads somewhere to where you have common sense to sit there and think, man, this doesn't sound right to sit here and do these to these children. Like, just make it optional. Let them have a choice. It's the same thing we all grew up with, was a choice. Thanks.
First of all, I know Bethel Park's watching. Holly Lissack, 880 Hershire Drive. I wear my Joey Strong, and I love him. Cindy, I'm very sorry. This is what Tanner said to me in the summer, or whenever we were finished with school. Mommy, I was having headaches. I'm having headaches. I said, on a scale of 1 to 10, what's your headaches like? We were discussing them. And he asked, where we live with on Joey Street. We love Joey. Joey's our friend. The Fabuses are like our best friends. We love them. I'm just saying what my son asked me. Okay? So I don't want to make waves with anybody here in Bethel Park. I'm just saying what I experienced with my own kids. And my kids, Tanner, asked me, do you think I have DIPG, Mommy? I said, no, I don't think you have DIPG, honey. It's okay. Well, we live on the same street, and I don't know what's going on, and I keep getting headaches. Well, what happened to Joey? I mean, we're a little terrified, and I'm very sorry it got brought up tonight. Was not my intention, but he did say that, and I'm just being honest. So I'm sorry, Cindy. I don't mean to hurt anybody's feelings or make waves with neighbors. It's the last thing I want to do. I love Joey, and I plan on doing his 5K without a mask. Okay? I'm sorry. I love you. And I'm sorry. You guys got a tough job, and I have to make masks optional for my kids. I mean, we have to decide in our home. I guess cyber it is. And again, our government really is not good for us. They're saying everything all over the place. We're all disgusted at this point. It's a shame we're divided. I mean, open borders. That's where I stand. They're open borders. Do they give a shit about us? They don't.
Please don't.
We got to care about our own kids, right?
Please
we
don't
do.
use profanity.
Well, this is where we're at. I'm sorry.
Please don't use profanity, ma'am.
I'm sorry. I'm sorry.
Thank you for your
But
comments.
this is where we're at. Open borders means he don't care.
Kathy Gibson, 3440 Forest Road. I wasn't going to get up and talk because I think everybody covered pretty much everything. But the only thing that I can say is that I sit here with a very saddened heart as to what we have become, that we have learned to bow down to higher authorities and not critically think for ourselves and use common sense. And one of these days, I will apologize to my children because they're going to probably see me on the news. Sorry. And but one day they're going to understand why I did this, because they need to learn that you have to stand up for yourselves, for your rights, and push back when you need to. It is very sad to me that, as common sense as it is, that you couldn't stick with optional masks. And to be honest, I really don't think, I think a lot of people ought to just yank their kids from school, because this is where it's going. 1 inch, take a mile. You start with a mask, you're gonna swab my kid's nose with this little company that Wolf contracted with. You're gonna tell my kid that he has to be vaccinated. Are you gonna, I mean, this is totally absurd. It's totally absurd, and it's sad. And I'm so sorry for these kids coming up, because this is so, I'm disgusted. I'm just so disgusted that you think you can just take another meeting because we didn't get what we wanted. Well, guess what? In life, you don't always get what you want. And it's obvious. And I want my kids to see that when evil happens, you stand up in the face of it and you push back.
Matthew Urian, 5520 King School Road. So obviously I'm frustrated and disappointed because you know where I stand. But I do like to try and get into people's shoes and figure out how they came to a conclusion. And I think I can understand if I given your views why you made the decision about more kids in seats, less quarantine. Unfortunately, I think there's a presupposition in that argument that was not addressed, because there really wasn't much internal debate tonight. The presupposition was that it was all, if we mask more, there'll be less quarantine. But we never explored the option that if we leave masks optional, there might be less quarantining because of less infection. See, we just roundaboutly put immunology back into a box, and we said it's about masking or not masking. But immunology is a very complex field, as we're all aware now. And kids' attitudes, how they eat, whether they're depressed, many things of this nature affect their immune system going into any sort of flu season, any sort of time. And so that's where I'm struggling, is there was no discussion of anything outside of masks. And I know it wasn't direct about masks, but really if you look at your presupposition in your argument that got you to where you were, it was just about masks. And I think it was just too narrow of a view of immunology to really make such a policy decision. So I just gotta say, it seemed from this side of the aisle, like you guys came in with your mindset, most of you. I do realize there was some changing, but there was very little discussion given the weightiness of the subject. So I do hope we reevaluate this sooner than a full semester. Thank you.
Diane Scavolone, Main Street. Oh gosh, every time I come up here, I forget what I'm going to say, but so many things. The emotions run high. I want to thank you for common sense, for using your God-given common sense. It flips, it flops, and I'm like, why are we living in fear? Why are you all bowing down in submission to fear? The CDC is not our lawmakers. We don't have to listen to what they say. We are breaking down as a community and as a country. Now, when these kids come back to school tomorrow, they know what's going on. The little ones and the high schoolers, they know what's going on. You think that the mask is going to solve all the problems? It's not going to solve any problems because the virus is still here. You're still going to have kids that are going to get sick. What happens then? Do you shut down school? What happens? Everyone's masked. We're all doing the mask. What happens when the outbreak happens again or when the kids get sick again? I don't know that answer. You guys do. Do you? I don't know. So, I mean, there's no common sense in any of this. I drove a school bus for 16 years, and that 7 years ago is when I quit that job. These little kids would go on the school bus, and they were very happy, jovial, happy to go to school. Fast forward 10, 12 years, these little kids are getting on the school with these long faces, not smiling. I didn't know what happened. I would say good morning to them. They wouldn't even reply back to me. I did not know what happened. And now we're going to mask them and continue on with that mindset, tearing them down. We are being torn down. Our children are learning this. What happens next? It doesn't make any sense. We are submitting to our government. You guys are part of the government that we are looking to you as leaders. What are we doing? Why? I want to know why. Why are we so afraid to live and to get along? You guys are part of the problem. Pay attention, read, do your homework. Russ, thank you for doing your due diligence. Thank you.
I'm gonna leave it.
Sean Tomaszewski, 2035 Millennium Court. As a third-generation Bethel Park resident who's about to raise a fourth generation of Bethel Park residents, I thank you all for listening, or 7 of you. I thank the 7 of you for listening to expert consensus in coming to your decision this evening and not listening to the whims of random social media posts.
Motion to adjourn?
Motion to adjourn. I need a second.
Second.
Seconded by Mr. Scalzo. All in favor, say aye.
Aye.
All opposed? Motion passes. This meeting is over.